I now recognize Mr. Thompson.
Thank you, Mr. Chairman, and thank you to the witnesses for being here today. Well, Medicare Advantage provides important benefits to some 54% of our nation's seniors. However, as has been pointed out, Medicare Advantage is not without its flaws, and those flaws need to be fixed. Reports of upcoding in Medicare Advantage raise concerns that patients are being given elevated diagnosis but little to no additional care. There are concerns that Medicare Advantage companies are limiting patient access to care by using prior authorization far more than traditional Medicare. Mr. Chairman, I ask unanimous consent to submit this Wall Street Journal article in the record that highlights this. And I also ask unanimous consent to submit this California Hospital Association study on the effects and cost of prior authorizations for the record. Thank you. The study shows that prior authorization delays contribute to at least $3.25 billion in avoidable cost every year, and that's just in California. Actions like these support the need to increase transparency and reporting around the Medicare Advantage program. However, Mr. Chairman, we can't discuss improving health care without addressing the 500-pound elephant that's in the room today. Access to care is going to worsen because of the Republicans' big, ugly bill, now the big, ugly law. Congressional Republicans just passed a $1.5 trillion cut to health care. Congressional Republicans cut $1 trillion from Medicaid, cut $500 billion from Medicare, and failed to extend the enhanced premium tax credits that make insurance affordable for middle-class Americans, all while adding over $4 trillion to our national debt. Mr. Chairman, I ask unanimous consent to submit this committee for the responsible federal budget report about the cost of the big ugly law for the record. 15 million patients will lose their health care coverage. At best, hospitals will reduce services that they offer in order to stay open. At worst, hospitals and clinics will close. I've heard from seniors in my district that they're worried that they will lose their Medicaid coverage, which contributes to their Medicare cost share. They're terrified that their health care costs will increase and that they will go bankrupt just trying to get the health care that they need. All because of the Republicans on this committee and in this House passed that big ugly law. It doesn't matter if you have Medicaid, private insurance, or all the money in the world to pay for your care. If your local hospital is closed or had to fire the surgeon who performs the procedure that you might need, you won't get the care that you need. Congressional Republicans also hamstrung the student loan access for future doctors. That's going to make it more difficult to have health care, especially for those of us in rural areas. And the attack on health care doesn't stop there. The administration wants to slash research funding. Mr. Chairman, I ask unanimous consent to submit this CBO analysis showing that NIH funding cuts and FDA staffing cuts would result in about 2 fewer drugs coming to market every year. Without objection, Mr. Chairman?
Yeah, without objection.
Thank you. However, this analysis is based on a 10% cut, is a low estimate because the Trump administration has proposed a 35% cut in NIH funding. CBO said that the administration's proposed cuts to medical research is so large that they haven't even been able to determine whether historical evidence can be generalized and reliably used to estimate the effects. Mr. Fielder, we're supposedly here to talk about Medicare Advantage, to distract from the devastating cuts to patient care because of this big ugly law. Can you explain some of the challenges that Medicare Advantage patients might face in getting the care they need due to the Republicans' cut on Medicare, Medicaid, and the ACA?
Propagandizing from our side. So I think with respect to Medicare beneficiaries, one of the most important impacts, and it flew a little bit below the radar, but is the challenges that Medicare beneficiaries are going to be facing in signing up for the portions of Medicaid that helps with premiums and cost sharing. So, one of the things that had happened during the Biden administration was they made a set of changes to automatically enroll some people who are clearly eligible based on the information the federal government already holds into those so-called Medicare savings programs. Under the bill, that will no longer go forward, and those people will have more difficulty enrolling in paying their Medicare premiums and paying for care they need.
So less access to care for Americans. Thank you very much. I yield back.